Hello and welcome to Peepul Health, an online platform bringing you live workshops, seminars, nutritional guidance and advice, and overall health and wellness information at the Peepul Centre. My name is Sumit, I'm the head coach for the gym and spa department, and today, again, joining us will be Khushbu Rawal, our registered dietitian. She did a fantastic talk on gut health, and we're going to go further today into talking a bit more about gut health and the common consequences. So Khushbu, welcome. Thank you very much for coming again. And so, gut health is massive nowadays, and so many people are aware of it. And there's so much information out there, the science, and there's still loads of studies going on. So what are like some of the common consequences of gut health?
You rightly said there's so many information all over the place about what it means and how it has an effect on the overall well-being of the patient. So I would say the commonly associated consequences, or the most frequent ones that we get to cater, are the ones that are caused due to faulty eating habits and bad lifestyle. We all know that our lifestyles have tremendously changed, and due to certain amounts of stress levels, inactivity, and having more amount of processed foods, these consequences are getting triggered more and are causing severe disorders, leading to sometimes severe diseases as well.
Brilliant. So what are some of these like common disorders? I know like I hear acid reflux a lot, or I hear IBS a lot.
Yeah.
So what are some of these common ones?
Yeah, the common consequences are constipation, diarrhea, heartburn, acid reflux, peptic ulcers, or the normal ulcers, ulceritis you can say it, and gastritis is one of them. Dyspepsia is associated with it as well. And more severe ones are like the IBS, which have a combination of these together, and hence they're called the irritable bowel syndrome, because they have a combination of these consequences at one single time. So all these consequences are still there, but in IBS, it's a combination of a group of consequences, conditions there.
Yes, we see that a lot, isn't it? Where a lot of people have like a gassy stomach or bloatedness, or there's loads of water retention. A lot of people are confused and they don't actually know what it is. And you mentioned that in the other video. So if we say IBS, is bloating like one of the biggest symptoms, or what's the myths and misconceptions with IBS?
Well, IBS, the causes of IBS are quite unknown as of now, but various other factors like these associated with the unhealthy gut can be related to having IBS as well. But when a person has IBS, a doctor or your GP would actually have to rule out certain other aspects of your diet, like putting in and out of certain foods, prohibiting it for a short period of time, just to rule out whether it's actually IBS, or sometimes it could be related to celiac disease as well. Well, one of the gastric disorders. So for that, to know whether it's IBS, they have to perform certain examinations, and then we can come to conclusion that this is IBS. And when you are diagnosed with IBS, there are a series of symptoms. Some people might just complain that they have this heaviness in the chest, or sometimes they just would complain that they have uncomfortable feeling after they have food before going to bed. And often these are associated with gas, flatulence, bloating. And so it's not one of the predominant factors, but it is one of the factors associated with IBS, yes.
Brilliant. We see that all the time. And it's, one of the things I hear all the time is a lot of people, when they have these symptoms, they immediately think there's some sort of intolerance, but they're not aware of IBS. So you rightly said, you have to go through, there's an elimination process where they have to cut down certain foods. There is a misconception out there, isn't it, that people can people mistake intolerances with IBS? Like, how do you know the difference?
Intolerances, to be honest, many people don't even realize if they have any intolerances in the first place.
Wow.
That's because it would sound unrealistic, but 75% of the world's population can't tolerate lactose. And that's just one example. to be honest.
Wow, that's a fact.
There are many foods that are not tolerated well by many people. So recognizing whether you are intolerant to certain food is going to be really difficult. But if you come across a food and you happen to show any disturbances in the stomach, or either your stomach gets upset because of having certain foods, try avoiding that food for a while.
Okay.
In the absence of it would be interesting to examine yourself or keep an eye on yourself whilst in the absence of those foods. In that way, you can at least recognize what triggering foods that you were having that were causing you stomach disturbances.
So somebody with IBS, if you don't know if you've got IBS, is it advisable to go to a GP or a dietitian? What would you say? Or just, as you mentioned, cut out the foods first?
IBS is treated with diet management and medications.
Okay.
So there are stages of IBS actually. So when you are having, the symptoms are from acute to mild. So when there are episodes which could last for a few weeks to few months, and then it subsides and then it returns back. So it's actually not possible to cure IBS, but it can be dietary or medically managed. So when we talk about the management of IBS, medications play a part and diet management also plays a part. Eliminating certain foods, making changes in the food, or breaking down the foods into having it at a different certain time, not having it late in the night, could be beneficial.
And could processing of these foods, like you said, processed food is a big thing now. And do you think it's increasing because the actual process of the food, or is it something which is inheritance, is something that...
By processed foods, we actually mean that foods that contain unhealthy ingredients. And these unhealthy ingredients are not good for your health, basically. So what are these unhealthy ingredients in that processed food? So either they are canned and tinned foods which have a lot of preservatives added in, so which is not good for your gut health. Secondly, these foods are made up of refined flours, and they don't have plant-based sources, so they don't have fiber-rich content in it. So that's why they are processed foods. So basically they go through a process of refined stage, that's why.
So IBS is, IBS is quite complex than what it is. And there's a lot of people out there who go through elimination diet, or there's probiotics.
Yeah.
There's many companies who are now starting to sell probiotics to put good bacteria inside the gut, and to remove the bad bacteria. Yeah. What's the process of probiotics, and do they work?
Of course they do work. Probiotics are a superfood for the gut, I would say. And these foods are actually providing good bacteria, like you said, to the gut, because the flora of the gut, the microbiome that you call, that means the bacteria that live in your gut, need nourishment. And this nourishment is provided by the probiotics. So the probiotics actually provide those good bacteria to your gut and nourish the gut health. And that's why your digestive process is improved and you have a healthy life, healthy gut. So probiotics is a must. Of course, I would personally recommend a minimum dose to start with, and usually having it 30 minutes before a meal is beneficial. And if you're having it for the first time, you should have patience, because usually it takes a few weeks to see some positive results of it.
So do you need to see, before you take the probiotics, do you need to get prescription? Do you need to see a GP?
It's always healthy to have a probiotic, even if you don't have any other of the consequences or any other disorders of the stomach.
Really?
Because probiotics actually help the gut microbial flora. So they provide the good bacteria. So digestion process would improve, that's it. But always, if you find any irritation due to it, always refer to your GP first.
Well, that's really interesting, because the amount of information and the amount of science that probiotics have, it's quite vast. It really has gained a lot of popularity.
Of course.
So in terms of some of the consequences, obviously, is like gasiness, acid reflux, bloating, and IBS. We just spoke about IBS, which is a complex situation in itself. What's the difference between IBS and acid reflux? And is like acid reflux one of the symptoms of IBS? Is it like related? Because
Yes.
a lot of people get mixed up with that as well.
Yes, true. Acid reflux is one of the symptoms of IBS. And acid reflux basically means regurgitation of the acids from the stomach to the esophagus.
Right.
So it's actually the backflow of this acid, the gastric acids. So it usually happens. People with acid reflux would usually complain of having an uncomfortable feeling after food, or they would just say that after 2-3 hours of meal, they feel like a bloatedness or sour feeling in the mouth, or chest pain.
Chest burn is a big
chest
one.
pain.
That's it.
Usually radiated towards the back, and it could be an acid reflux. Sometimes the pain in the acid reflux sometimes could be mistaken with the angina, which is a cardiac problem actually. And it won't be wrong if I say that some patients do have both of these coexisting pains together. And acid reflux is usually the pressure that is caused. It actually happens or occurs when the pressure inside the stomach is more than the muscles around the where the esophagus and stomach meet. So because the pressure is more, it's bound to backflow, and gravity works against the normal digestion, and that's why the acids go up. And that's why when people or maybe somebody suffering with acid reflux, when they bend over or they lie down horizontally, that comes up.
That's
and
correct. Because I mean, there are times we hear that a lot in patients where I feel a bit of a burn when I'm bending over, or when I'm lying on my back is a common one. When I'm lying on my back, I think with
this
my head
is
up,
usually caused because of having heavy or large meals at late in the night. Because after late night dinners, you usually don't have any high activity levels, and it's always a resting time. So having high foods which are high in sugars, or which are high in fatty acids and fatty foods and fried foods and spicy foods, having those foods in the night time could trigger all these things like acid reflux and all.
This is true. This is interesting because we see a lot of members and clients who, and a lot of people out there who, there's a misconception in the training world when it comes to muscle building, and a misconception with the diet world and like the gut health, that a lot of people recommend that you need to actually, if you want lean muscle, if you want to grow muscle, then you have to have a meal before you sleep, because when you sleep is when you recover. When you're recovering is when you're growing new collagen and stronger muscle fibers. So this is interesting because somebody who's got acid reflux but wants to gain lean muscle. I mean, there's that misconception there. That awareness is not there, I guess, right?
Yeah, I would say having meals 3 hours before, 2 to 3 hours before the bedtime is beneficial, and including more lean protein, or the foods rich in protein and fiber should be like the veggies, beans, whole grains, and fresh fruits. These are helpful to add in the diet because they don't provide those extra calories, or they don't provide unnecessary fatty content in the body. Other foods would have other foods that are high in which are deep fried or have more fats should be avoided during the night time.
So this is interesting because the other most interesting thing is supplements. So gut health is a big one, and it's really become a lot more popular.
Sure.
And there's a lot of people out there who are saying that a lot of supplements can actually trigger gut issues as well, because obviously supplements are also a part of their process, aren't they? They have preservatives as well. So is there like, can taking supplements, damage your gut, create even more bad bacteria? Is that true?
Well, some of these supplements are found to have shown to create disturbances in the stomach, and cause stomach upset. This could be not just because they are processed food, but they could be because of the high protein content, and your body
Right.
is not accustomed to having that high levels of protein. So when there's a overload of proteins, sometimes it takes time for the gut to digest it, and hence you might have stomach upset issues with that.
This is why a lot of people who do have like acid reflux or IBS symptoms, a lot of people recommend whey protein is a common one, and it backfires.
Yeah.
Because
your body is not
it's
accustomed to
not
it. Exactly.
accustomed to it. And,
Exactly.
and that's another myth actually.
Yeah.
People think that you're not getting enough protein, so then you need to have protein shakes or whey protein. I mean, can you get enough protein just from a healthy diet?
Of course. It's difficult for any vegan or vegetarian to secure proteins, but it's not actually impossible. Including more amounts of whole grains, beans, lentils, and pulses in the diet. If you're non-vegetarian, then including lean meats in your diet can increase the protein content of your diet actually. So it's not as if, well, people who have egg, they don't have to worry because egg provides the most amount of proteins. So including more amounts of eggs preparations in your diet can improve your protein content.
Brilliant. The other common one is ulcers,
Yes.
peptic ulcers.
Yeah.
You mentioned this in the first video. Could you give us a bit of information on what ulcers are and how it happens?
Ulcers are basically the erosions or the aberrations caused in the inner lining of the gut, and these are caused due to having faulty foods actually. Sometimes they are even caused by having disturbing the microbial flora, as we talked about earlier, because microbial flora it just gets disturbed if you have certain foods like spicy foods, sometimes due to even chocolate, caffeine, carbonated drinks, having a lot of alcohols.
Wow.
And when these foods damage the inner lining, then the erosions or the aberrations are caused in the inner lining. And these actually go that worse to an extent where they cause bleeding. And that is basically the first alarming symptom when you recognize you might have peptic ulcer.
Wow. So if somebody, what are the symptoms then? What happens if somebody's got ulcers?
Yeah, well, usually you won't realize until you feel like a triggering pain. It's a very it's sort of a cramping or very particular type of pain, a gnawing pain or something, which is so painful that you can actually make out, because any food you eat whilst you have peptic ulcer would actually cause irritation to those.
Wow.
Erosions, and hence you would feel that uncertain pain there.
Is that like constipation, or is it?
No, it's quite different from constipation. Constipation would be a struggle to eliminate your waste,
Right.
but this is actually inside the stomach or maybe in the intestine. So it could be wherever the ulcer is. The symptoms are going to be common.
Is it like a cramp, or is it?
It's a cramping sort of pain, and it's really a burning sort of pain.
Similar to period cramps?
It could be, yeah, could be associated to. Actually, sometimes it can be mistaken to period cramps as well.
Right.
But yeah, this pain is really particular. You can actually figure out it's really annoying pain or very burning sort of sensation inside the stomach.
Does it come and go? Does it stay every time? Is it every time you have food, or every time there's digestion
In
process?
some people, it comes and goes, and usually it settles down as soon as you have any antacids or even have milk. But in some patients, it actually stays for a longer time or even forever.
So what do you do? Do you see a GP? Do you get it? Is
Yes,
it like an MRI scan?
Well, there's stages of peptic ulcer when you manage it, because if it's too worse, then if it's at the end stage or if it's at the worsened stage, you might be bleeding in your stools.
Right.
And that's when a GP recommendation is necessary. That's when lots of examinations have to be done to see, and then usually the treatments are either through medicines or sometimes even surgical treatments have to be performed.
Wow. So is this like, so peptic ulcers is is it through lifestyle changes like bad diet, bad food,
Sometimes
or is it hereditary, or is it like?
No. It won't be. I won't say it's hereditary. these are due to faulty food habits, exactly.
Right.
And sometimes you have certain foods that cause too much acidity in the food. They have too much acid content of the food, and then when you have such foods, they cause irritation in the food, in the stomach, and hence cause such aberrations or erosions in the stomach. And one thing I would point out here is when you have these erosions or ulcers in your stomach, it's actually good to treat it in a way that you reduce the irritants. You have to manage in a way like you don't irritate it much. Like mechanical, chemical, and thermal irritants should be avoided in this case.
Wow.
When we talk about thermal irritants, any extreme hot or extreme cold foods should be avoided because it could create sensation there and it could worsen the symptoms.
This is true because there's a lot of people out there who eat hot food.
Yeah.
And they feel these symptoms.
Yeah.
There's an irritation.
Yeah. So it's basically causing irritation to the ulcers, and that's why you feel uncomfortable.
All right.
And the same way, there are mechanical. So mechanical, like foods rich in fiber, which are a bulky content, which have a bulky content of the food. So these foods, when you take in, they actually have the fiber that can irritate the lining of the intestines. And if they brush past it, they cause, like any bruise, if you imagine, if you have any bruise and you even brush a cloth over it, you could feel an irritation around it. So in the similar way, if you have such ulcers inside your gut, and if you have fiber-rich foods which are very brushy and all thick in soluble fibers, so these foods, when they brush past these erosions, they actually feel pain and uncomfortableness.
So what does someone do then with
just manage these with by avoiding these thermal, mechanical, and chemical acid. Like chemical irritants are the ones which are like fatty foods, deep fried foods, spicy foods, caffeine, chocolate. They are found to be irritants in causing irritability to the gut.
So can someone with ulcers go through an elimination diet to understand which foods are causing the irritation?
Yeah, when ulcers are there, so usually people avoid most of the foods. So
right.
Because they feel nothing is working for them. So they usually try to eliminate most of the foods. But what happens is then they are nutritionally deficit. So managing the nutritional health and your diet is a really challenging part, and that's where a dietitian or a doctor could help, because settling down the symptoms would be the first and foremost thing to do. Then as the symptoms gradually subside, including foods that you would be having usually in your diet could be helpful. Then gradually including foods that could be well tolerated by the gut is beneficial. So gradually taking 1 or 2 meals of the foods that you desire or can well tolerate would be beneficial. So that way a diet is modified according to your tolerating level.
So this is interesting because gut health is a very complex issue with a lot of people. So now obviously we understand like it's a lot more complex and there's a lot of things involved in it. So we would always recommend, if you are somebody who's experiencing those symptoms and the consequences, then to see a dietitian, because they will be able to get a bit more a deeper level of understanding, or more specific in knowing exactly what it is. Is that correct? Yeah,
because you can just calculate in a way like a gut. What is a gut? It starts from mouth and ends at the rectum. So it's that bigger part of your body. It has so many different parts of your body connected to it. And if that's the case, any disturbances at any level it is at a part, or whether it is at the entire part of it, whether it's just at the stomach or whether it's just at certain point of an intestine, it is severe enough, and it could cause something which is bad for the entire gut. So if you have any symptoms that are making you feel uncomfortable, which are disturbing your gut health, do visit your GP, talk about it. They would be helpful and give you advice about how you should manage it. and then maybe even refer you to the dietitians, where dietitians could be of more help.
Yeah.
Yeah.
This is good because another important topic is that in the weight loss world, obviously losing weight. When we say losing weight, we mean fat. There's a lot of people who have gone on the journey of losing weight, and then they reach a roadblock, or they just don't lose any more weight. But then we find that that when they start to spiral, they start to go the opposite direction. They start to put weight on again because they've not addressed these issues. So could overweight be linked to like gut issues, or can gut issues demotivate people? And because you've missed the gut, you've missed the whole, you've missed out what actual the gut issue is. You've not addressed it, so therefore you go back to your eating behaviors and go back to just dealing with the pains that you've been feeling.
What actually happens is, like you said, weight loss process is a process where you have to have patience and gradually cut down on your diet. But if certain things, like certain consequences occur, people do take a step back, and then they don't want to come back to it because they feel this is a stopping point for them, and they can't go further from here. But actually, it could be some other reasons behind it as well. Your body is not actually used to with something. When you put your body used to with things, when in a weight loss process, you actually going through stages. Exercise, dietary modifications, your routine has changed. So your body is not accustomed to. It takes time to adapt to things. And when you do more exercise, you feel more hungry, and then you end up eating what's not suitable. That could cause weight gain again, or maybe even cause symptoms. If you happen to eat certain foods for a prolonged time, it could leave you with either diarrhea or either cause certain issues. Like, depends what food you eat ultimately. So even if you're in a weight loss process, it depends what food you are taking.
And that's what we always recommend now. The approach we have is different. At the Peepul Health, is we now look into, we take it the next step further. Before it was calories in, calories out, but we know that that's not enough. Now the approach is that, okay, we have a dietitian because we want to address these gut issues, because that's very important, isn't it? Because not a lot of people look at this, especially in the commercial market. A lot of people, it's always about calories in, calories out. But gut health plays another massive role in overweight and how much weight you lose.
Even in a daily lifestyle, I would recommend maintaining a healthy gut is beneficial for anybody. Even if you have any symptoms, even if you don't have any symptoms, it doesn't matter. Maintaining a good gut health is really beneficial, because then it digests your food properly, and then you get all the nourishment, all the nutrients get absorbed properly at a proper place in your gut, and that's why it gives you a good health ultimately. So even if you're not into a health world or not into fitness world, it's normal routine of maintaining a good gut health by following certain basic lifestyle changes of improving towards the healthier part of, because the world has become as such that we are in such a hectic schedule all day. We can't devote a particular time for our own gut health. We're looking after so many things at the same time, so just focusing on one. So basically, not to focus on one thing, but focusing on the overall thing, like making small changes that could ultimately help all of the aspects of your health as well.
This is what we're saying. We're saying when it comes to your health and wellness, the gut health doesn't just affect you physically, with obviously internally with all the organs, but gut health will also impact your mental and emotional well-being, because you just, if you don't know what it is, and if you keep getting those consequences and those symptoms, then you will be kind of in a bit of a rut.
True.
So it's good. I mean, this is correct. We we recommend that it's not just about the typical calories in, calories out, or just start exercising. We are now actually recommending a lot of individuals to think differently, and that new way of thinking is that begin with your gut. Would you say this is a fair statement to make?
True, it is. Of course, if your gut is healthy, then it maintains an overall health for you as well. So the healthier you eat, the healthier gut you have. The healthier gut you have, I see it personally as what you are what you eat. So basically, if you want to have an overall health improved, then you have to start at your gut.
And yes, we'd like to add on to that as well. When you mentioned you are what you eat, the other thing we would like to add on that is that you are what you eat, but it's also you are what you absorbed and catabolize and excrete.
Sure.
This is where the gut health.
Yes, of course.
In, so.
Well, that's one part of one of the consequences of the gut health, like malabsorption. Sometimes the gut health is not that accurate, and even though you're eating healthy, there are certain factors that cause malabsorption, and then what nutrients should be absorbed are not being absorbed properly, and hence you're deficient on those nutrients, causing an unhealthy body.
Brilliant. So there's a lot of information on there about gut health. You've helped us understand a lot of myths and misconceptions.
Sure.
And we've learned that it's not just important to just start exercising daily and it's not just about eating clean or healthy, but we need to also now start to understand our gut and microbiome and how it's affecting our optimal well-being on a daily basis. So thank you very much, Khushbu, for coming back and talking a bit more about gut health and giving us more information. We sure will be talking a bit more on food and nutrition in our other seminars coming up. So there we have it, guys. There's some more information and loads of golden nuggets on gut health, microbiome, everything related to IBS, acid reflux, and other symptoms, and peptic ulcers, and what to do, and the management of all these symptoms. And thank you very much for Khushbu, our registered dietitian at Peepul Health, People Center. So thank you very much, and we look forward to seeing you in our next video.